Hi, Amr the pharmacist here, and in recent news, we've had Luke Perry, actor, age 52, actor of 90210, recently passed away of a stroke, and John Singleton, the director of Boys in the Hood, age 51, also died of a stroke. And these people needed to be, their families decided not to resuscitate them, and now they're gone. Stroke. So what is stroke? What is the stroke that killed them? Stroke is basically where you have people who have blockage in their arteries. So when you smoke, you high cholesterol, plaque develops. Plaque develops in your arteries, and a piece of that plaque breaks off and travels up to a smaller tube in the artery. And it could go up to your brain area, where it just blocks oxygen from coming to your brain, and then you can get this droopy, let's say it comes here, it's droopy. You have almost paralysis of the face, pain in the jaw. You can't talk, you can't communicate because you're having a stroke. This needs to be done immediately, dealt with, and this can life altering. I mean, you may never be the same, so you need to take care of this. So the best way to do is prevention. So people throughout the years have been preventing stroke by taking daily aspirin, like baby aspirin, or most commonly recommended by doctors is enteric-coated aspirin. It's just aspirin with a coating that passes through your stomach to your intestines, and it's supposed to be easier on your stomach, and it doesn't dissolve right away, so it doesn't cause the bleeding. Well, anyway, according to the American Heart Association, new guidelines that came out here, we're in May 2019, they're saying that not so fast, not everyone should be taking it. So should I take aspirin for protection? They're saying no, but it depends. Yes. So you could take it as a secondary benefit. So not as a number one prevention, as has been in the past. So they're recommending that continue to take aspirin if you have angina, peripheral artery disease, stroke, heart attack, those things. But there's a change in the thinking based on the fact that there's more bleeding risk involved. So the older you get, the more chances of bleeding. Does it really outweigh the benefits? Well, that's the thing. So the risk of bleeding, stomach bleeding, is higher when you get older, especially people over 70. They tend to be more at risk. And so you have to watch them because they also have other anticoagulants like warfarin and things like that. So we have to take that into consideration. Also, there's a myth about buffered aspirin. Like, is that better, that causes less GI bleeding? No, that's not. That's more of a myth. It does help a little bit, but not to the degree everyone thinks it is. And should I stop if I don't have a cardiovascular history? And the answer is yes, for the most part, as a primary reason. Should I taper? If I'm taking it, should I taper my doses? No, you don't need to, because aspirin you can stop right away, and it'll be taken care of because you're constantly reproducing platelets anyway. So what does aspirin do really quick? I'm going to tell you real quick. So when you cut yourself, you coagulate the blood. That's called platelets, is what coagulates the blood. Aspirin comes and it sort of slows down that process, stops that process. So that's why you keep bleeding. That's why it's also known as a blood thinner. But talk with your doctor and find out if this is the right thing for you. Not everyone should just jump on a bandwagon and start taking aspirin like, taking a vitamin. Talk with your doctor first and see if this works for you, okay? I hope you enjoyed it.